In this year, with so much information at teens' fingertips, you might think schools are doing a great job of educating them about sexual health. But the truth is, many schools are still missing the mark on essential topics. What teens need is a curriculum that goes beyond biology to include discussions on relationships, digital safety, LGBTQ+ inclusivity, and much more. Here's a breakdown of what schools often skip and why that's problematic for today's teens. Number 10. The importance of consent. Not just a buzzword, a lifesaver. Most teens have heard of consent, but many don't fully understand it. Sure, they're told, no means no, but are they really taught that consent is ongoing and enthusiastic? Many sex programs fail to explain that consent needs to be present at every stage of intimacy before, during, and after. What's more, many teens aren't taught to recognize nonverbal cues, which can be just as crucial as a verbal yes or no. Studies show that comprehensive sex programs that teach about consent significantly reduce rates of sexual violence. Imagine how much healthier relationships could be if every teen understood that true consent involves mutual respect, clear communication, and the ability to revoke permission at any time. In fact, research shows that states with comprehensive consent education have lower rates of sexual misconduct among teens. And it's not just about protecting against unwanted sex. It's about promoting respect, equality, and mutual understanding in all relationships. Number 9. LGBTQ+ inclusivity. Teaching beyond the binary. Let's be honest, sex education has historically been heteronormative. The lack of LGBTQ+ content leaves many teens feeling invisible. Only 3 states, California, Oregon, and Washington, require LGBTQ+ inclusive sex education. This leaves a huge gap for teens who identify as LGBTQ+, many of whom have no one to turn to for guidance. Failing to include LGBTQ+ content not only alienates queer students, but also perpetuates harmful stereotypes. These students are at a higher risk of mental health issues and are more likely to face bullying and harassment. Including lessons about diverse sexual orientations and gender identities can create a more accepting school environment for all students. Even in states where LGBTQ+ inclusion is mandated, many teachers feel unprepared to handle these discussions. This can lead to awkward or incomplete lessons, where students are left with more questions than answers. Comprehensive LGBTQ+ education isn't just about recognizing different identities. It's about teaching respect, empathy, and inclusivity. Number 8. The discussion about sexual pleasure. Let's get real. Sex education tends to paint a grim picture of sex. Pregnancy scares, STIs, and awkward conversations with your parents. But what about sexual pleasure? It's rarely discussed, yet it's a natural part of human sexuality. By avoiding this topic, we're setting teens up for confusion and shame. Studies show that when young people are taught about sexual pleasure within a respectful, consensual context, they're more likely to develop healthier attitudes towards sex. Understanding their own bodies and communicating about pleasure can help teens build healthier, more fulfilling relationships. But without this knowledge, they're left to piece things together from unreliable sources like pornography or hearsay from friends. When schools include discussions about pleasure, it demystifies sex and makes it easier to talk about. Plus, teaching about mutual respect and communication in intimate moments can help teens develop better emotional intelligence. Number 7. Contraception choices. More than just condoms and pills. Most schools offer limited information on contraception, typically covering condoms and birth control pills while neglecting long-acting reversible contraceptives like intrauterine devices and implants. Emergency contraception, a critical option when other methods fail, is often overlooked. Research shows that nearly 1 in 5 sexually active teens don't use any contraception, largely due to a lack of comprehensive education. Abstinence-only programs exacerbate this by withholding crucial details. Teens deserve thorough education on all contraceptive options, emphasizing both their effectiveness and the importance of making informed decisions to prevent unintended pregnancies. Number 6. Mental health and sexuality. A missing link in sex ed. Sex is not just a physical act, it's deeply tied to mental and emotional well-being. However, most sex ed programs fail to address this connection. Teens who struggle with body image issues, low self-esteem, or mental health problems may be more vulnerable to unhealthy relationships and sexual experiences. According to the World Health Organization, comprehensive sex education should also focus on emotional health and how it intersects with sexuality. By addressing mental health in sex, schools can give teens the tools they need to navigate the emotional complexities of sexual relationships. This could include discussions about body image, self-worth, and the importance of emotional readiness before engaging in sexual activity. Mental health support within sex education can also help reduce the stigma around seeking help for emotional struggles related to sexuality. Number 5. Digital boundaries, sexting, cyberbullying, and online privacy. In 2024, teens are more connected than ever before, but their education on digital boundaries is lacking. Schools might talk about physical boundaries in relationships, but they often ignore the digital space, where sexting and cyberbullying are rampant. A study found that nearly 1 in 4 teens have sent a sext, and many of them don't fully understand the risks. Teens need to be educated about the potential long-term consequences of sharing explicit content online. They should also learn how to protect their privacy and set boundaries in digital communication. This includes knowing what to do if they receive unsolicited explicit messages and how to report online harassment. By ignoring these topics, schools are leaving teens vulnerable to exploitation, cyberbullying, and long-lasting emotional damage. Number 4. The limitations of abstinence-only programs. Abstinence-only education has been criticized for decades, and for good reason. It's ineffective. Research consistently shows that teens who receive abstinence-only education are just as likely to engage in sexual activity as their peers who receive comprehensive sext, but they're less likely to use protection. Despite this, abstinence-only programs are still widely taught, particularly in conservative states. These programs often frame abstinence as the only morally acceptable choice, ignoring the reality that most people will become sexually active before marriage. What's worse, they frequently fail to mention contraception or sexually transmitted infection prevention, leaving teens unprepared. In contrast, comprehensive sex education equips teens with the knowledge they need to make informed decisions about their sexual health. Number 3. Building healthy relationships. It's not just about sex. One of the biggest gaps in sex ed is the lack of focus on relationships. Sure, teens learn about sex, but do they learn about how to build a healthy relationship? Not really. Schools tend to focus on the physical aspects of sex, neglecting the emotional components that are just as important. Teens need to learn about communication, trust, respect, and how to recognize unhealthy behaviors in a relationship. Teaching about relationships goes hand in hand with teaching about consent. Teens should understand that a healthy relationship is built on mutual respect and understanding, not just sexual attraction. When schools include relationship education, they help teens develop the emotional intelligence needed to navigate romantic relationships later in life. Number 2. Sexually transmitted infection, not just scare tactics. Sex education often relies on scare tactics when discussing sexually transmitted infections. Teens are shown graphic images of advanced infections or told horror stories about the consequences of contracting and sexually transmitted infection. While it's important to educate teens about the risks, this approach can backfire. Fear-based education can lead to stigma, which discourages teens from getting tested or seeking treatment if they suspect they've contracted and sexually transmitted infection. A better approach is to provide factual, non-judgmental information about how sexually transmitted infection are transmitted, how to prevent them, and what to do if they're contracted. Teens should also be educated about regular sexually transmitted infection testing and how to talk to a healthcare provider about sexual health concerns. By taking the fear out of the equation, schools can encourage teens to take proactive steps in managing their sexual health. Number 1. Accessing sexual health services, the right to confidentiality. Perhaps one of the most important lessons schools fail to teach is how teens can access sexual health services. Many teens don't know that they have the right to seek confidential health care, including contraception and sexually transmitted infection testing, without needing their parents' permission in many places. This lack of knowledge can prevent teens from getting the care they need. Teens need to be informed about where to go for sexual health services, how to navigate the healthcare system, and what their rights are when it comes to confidentiality. By empowering teens with this information, schools can help them take control of their sexual health. Thanks for watching. If you found this deep dive into the gaps in sex education eye-opening, make sure to hit that like button and share your thoughts in the comments. Don't forget to subscribe for more insightful content that uncovers what schools don't always teach.